Alright, hi there, my name is Katja Berthled, and today I will be demonstrating how to give a subcut injection. So our scenario here is February 7th, 2021, and the time is 8:25. So we'll compare our physician's orders to our MAR. So we have Jake Nursing, fin number 312654987, 312654987, date of birth January 1st, 1960, January 1st, 1960, Dr. Skills Lab, Dr. Skills Lab. Looking it over, we're not missing any signatures, which is good, everything's signed for, and it says that there are no known allergies at the top, but we'll confirm that when we get to the bedside. So we're going to start going through the drugs. We have metoclopramide, 5 mg, subcut, daily, and there's one time given here. It's for 8 o'clock, and it's February 7th, 8:25. It's not signed for this, so this drug has not been given, so we're good to give this drug. Next we have diamond hydronate, but this one is for 2100 hours, so we will not be giving that at this time, so we can skip that for now, and we'll move that off to the side. So now we can prepare our metoclopramide. So we'll first select our drug here. This is in fact metoclopramide. It's 5 mg per ml, and we need 5 mg, so we'll need 1 ml. Subcut, this says that it's for IM and IV, but I've already called the pharmacy and verified that it can be given the subcutaneous route. That's just an off-label route for this drug. So we're good to give that. We'll compare it to our parenteral drug monograph over here. So metoclopramide says it can be given by a student nurse. The maximum single dose is 20 mg, which is okay because we're only giving 5. It can be given the subcutaneous route, and the maximum concentration is 5 mg per ml, which is this concentration we have here. So we're good to get that ready. I have my alcohol swab for that, and then I will grab a 3 ml syringe, my blunt fill, and because this is the subcutaneous route, we'll take a 25 gauge 5/8 of an inch needle. There we go, and I can wash my hands, my hand hygiene before we begin. So I'm going to clean the top of this vial for 30 seconds. So it's been 30 seconds, we're going to let that air dry, and I can get my syringe here already. And we'll be getting 1 ml of this. And careful not to compromise the sterility here. We'll bang out these bubbles. See if that's perfect. There. Out, and we'll pull this into our barrel, scoop that up, and into the sharps container. Next we can banana peel this one open and put that on. Then we will shut the excess, making a little bleb there. And showing this to the camera, we have 1 ml there. Right on the 1 ml. Kind of hard to see because it's black on black, but whatever. So take that and I'll make my label. So we have Jake Nursing. Drug is metoclopramide. We're giving 5 mg, which is 1 ml, because it's 5 mg per ml. Date and time, it's February 7th, 2021 at 8:25. Initials KBUMSN2. Show that to the camera. Okay. Good, so we can do our second check here. So Jake nursing, metoclopramide, 5 mg, that's 1 ml. I have 1 ml here, and that's because it is 5 mg per ml, and this says 5 mg per ml on here as well. Subcut, so we have a subcut needle on here, the 25 gauge, 5/8 of an inch needle. And this says I'm an IV, but we confirmed with pharmacy that it can be given the subcut route. Daily, there's one time here, it is 8:25, February 7th, and it has not been given yet. So we're good to give this drug. I can collect all my supplies for this. This is a one-time use vial, so this can just go into med waste. Oops. Got my needle there, my label. I also need an alcohol wipe and a cotton ball and my pen. So we're gonna go to the patient's bedside, which is the other side of my table. Okay, there we go. Knock, knock, knock. I'm doing an entrance safety check. I'm making sure the bed is at an appropriate height. The call bell is within reach. Side rails are up. No debris on the floor. I'm going to introduce myself. Hi there. My name is Katya Berthlet. I am your student nurse today. I can do hand hygiene. And would it be okay if I looked at your wristband? Okay, perfect. So we're going in here, and I don't know if you can really tell in the camera, but the wristband's right here. So Jake nursing, January 1st, 1960, January 1st, 1960. Could you state your name and birth date for me, please? Perfect. I have the right patient. And do you have any allergies? No? Okay, perfect. That's what I have here. So I'm gonna do my third check here to make sure I have the right medication with me. Get this out. So we have Jake nursing, metoclopramide, 5 mg. 5 mgs is 1 ml. I have 1 ml here. That's because it's 5 mg per ml. It's also subcut. We have a subcut needle on here, the 25 gauge, 5/8 of an inch needle. And it's also given daily. We only have one time here for 8 o'clock. It is February 7th at 8:25, and it's not signed for. It hasn't been given yet, so we're good to give that drug. So that all checks out. Now I can do patient education. I'll let you know we are giving you a needle today. It's going into the fatty tissue. We'll be putting it into your abdomen. I'll demonstrate where that is in a second. And we're going to be giving you the drug metoclopramide. It's an antiemetic, so it'll get rid of your nausea or your vomiting. Some side effects of that are drowsiness, dizziness, headache. If you experience any of those or you generally just feel unwell, pull the call bell next to you. Also, some things that we're monitoring for. We've already taken your vital signs and done a GI assessment. And we will continue to do that after administration of the drug just to make sure that you're benefiting from it and that you're maintaining your baseline there. So I'll show you here. This is my belly button. If we're giving it in the abdomen, we want at the belly button or slightly below belly button level, and we want it outside of this 5 centimeter ring around the belly button. So about, I'd say, down here in the fatty tissue. Okay, so I am good to hand hygiene, wash my hands, and I can put on my gloves. I'm going to move actually my injection pad over here so you can see it better. And we're going to cleanse the area for 30 seconds. It's been 30 seconds. We're going to let that air dry. this I'll just put there. Now I can get my needle ready. We're going to be pinching an inch and inserting at a 45-degree angle. And I can stabilize, and we're going to inject. I can release my stabilization, take out my needle, and release my pinch. We'll put a little cotton ball on there, making sure not to massage the area. I'm going to activate my needle, but because I need to reuse these, I'm just gonna cap it here. So just gonna scoop that and dispose of it into my sharps container. Now I can grab my supplies, so I'll move this back over here. Take my garbage, take off my gloves, wash my hands. And I have my pen here. I'm going to sign for my medication with the KB UMSN2. You can see that there. I think that's clear enough. Okay, I'll grab my stuff. So we are going to be back in the next half hour to see if the drug's therapeutic effects are kicking in. We're also going to be continuing to monitor your vital signs and do another GI assessment later on. Again, if you feel any of those side effects that I mentioned earlier, don't hesitate to pull the call bell, and we'll be back to check on you later. Good, I'm going to do an exit safety check, making sure the bed's at an appropriate height, side rails are up, call bell is within reach, and that there's no debris or hazards on the floor. And without further ado, that's all good. All right, you were a very good patient.